Treating leukemia is like putting together a puzzle with different pieces. There are many ways doctors try to help people with leukemia get better. There are 4 different types of treatment, which include chemotherapy, targeted therapy, immunotherapy, and radiation therapy. Let's explore the different treatments for leukemia and how they work to help patients achieve remission and improve their quality of life. Chemotherapy is a powerful treatment that uses drugs to kill leukemia cells. These drugs can be taken as pills or through injections, and they work by targeting and stopping the growth of rapidly dividing cells, including cancerous ones as well. Here's an image of an individual receiving chemotherapy treatment. Targeted therapy is a cancer treatment that uses drugs to identify and attack cancer cells while causing less harm to normal cells. Targeted therapy specifically targets the changes that make cancer cells different from normal cells. Here's an image of an individual receiving targeted therapy treatment. Immunotherapy is a cancer treatment that uses the body's immune system to fight cancer. It works by stimulating the immune system or providing components to target and attack cancer cells. Here is an image of an individual receiving immunotherapy treatment. Radiation therapy uses high-energy rays to kill cancer cells. It's like using a targeted beam of powerful energy to shrink tumors and stop cancer from spreading. This treatment can be given from the outside the body or by placing radioactive material near the tumor. Here's an image of an individual receiving radiation therapy treatment. Watch the following video featuring individuals undergoing different types of treatment for leukemia.
Compared to other cancers, you're actually quite lucky. People with breast cancer and things like that, their treatment goes on for years and years and years. I had 4 months worth of chemo, a transplant, and my treatment was effectively done. Yes, it's taken me 18 months to recuperate from that, but actually, it might not feel like it when you're in the midst of the storm, but actually, it's quite a quick process.
I had 2 rounds of chemotherapy, and I was feeling fantastic. You know, the cancer was in remission, I was out running, I was able to look after my children. I felt pretty good.
I was actually put in a remission after 4 weeks. I mean, the difficulty with leukemia doesn't lie in getting rid of it. I think it's stopping it returning.
I had none of the white blood cells that are required to fight infection. They waited a couple of weeks to see if those blood levels came back up, and they didn't. I was admitted immediately and I started chemotherapy the next day. I went in purely focused on the transplant. I'd given no thought to the 4 days of chemo, the 4 days of radiotherapy before the transplant. I arrived and you're handed a schedule of your treatment, and I looked at it and I was like, oh God, there's other stuff.
First, when you go into hospital for your transplant process, you have a round of chemotherapy, which was the shortest round, but for me it was the most grueling. It made me very sick. And then I had total body irradiation for 4 days, just to kill off any last leukemia cells within your bone marrow.
There's a sense of loss of independence and of empowerment, particularly at the times during that treatment when you're not well. I had to be hoisted from the bed to the chair and the chair to the bed in a hoist, a hydraulic hoist, which is, you know, very degrading.
I remember seeing my transplant nurse and just saying, so what happens if I just decide that I don't want to have the transplant now? And she looked at me and she said, oh, well, you die. And I said, oh, okay, so there's no turning back now. And she said, no.
The treatment for leukemia is to get you into remission first. Before a transplant can be done, you have to be in remission.
Obviously, you have days when you're really sick, but it wasn't endless at all. It was, there was far more days when I felt fine.
Each of these treatments play a crucial role in helping patients fight against leukemia and improve their health. By understanding the treatment options, we can support those affected by leukemia on the journey to recovery and better health.